This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're in the Healing Garden at Aurora Medical Center in Oshkosh. We're going to be speaking with Dr. David DeWitt. He's an orthopedic spine surgeon, and we're going to be talking about the different options that are available to people dealing with neck, back, and other areas of pain. Well, thank you for taking some time with us today. You know, so many people deal with back, neck problems, pain, soreness, but a lot of times it's neck and spine related, and that's where you come in. When does somebody actually need to get into the surgical area that you deal with?
Yeah, well, I don't look at myself as a surgeon. I look at myself as a physician first and foremost, and patients don't come to me because they want an operation. Patients come to me because they want information. They want to know what's going on. And we spend a lot of time focusing on pain generators, and we have surgery and non-surgery doctors in our group that provide those services. And it's really for the patients that have an identified problem with their anatomy. So there's some piece of their spine that's causing a problem, whether it's just a back pain related or a neck pain issue, or they're having a pinched nerve or a pinched neural structure like the spinal cord that's causing their problem, that if they fail conservative care, that they may be a candidate for surgical intervention to fix their problem.
And when you're talking about conservative care, are you talking about rehab and things like that before
Physical
surgery?
therapy, chiropractic, injections. Injections can be both therapeutic and diagnostic, and a lot of people don't understand that. Depending on where you put the medicine and what you're putting in there, shots can be very different, and they're very valuable to us in terms of helping us identify a particular pain generator for a patient, because we have beautiful technology like MRI, which shows us a lot of things, but it shows us a lot of things that aren't causing the patient's problem. So especially if there's lots of wear and tear issues going on that we see on the MRI, we don't operate on what looks bad on the MRI, we operate on what is causing the patient's problem. But first and foremost, you got to identify what that is, and that's where injections can be very valuable in terms of helping us identify a specific pain generator.
Yeah. So as a physician, you're not necessarily saying the first thing we have to do is get in there and start doing surgery. You're looking for other alternative means.
Correct. I tell patients there's nothing over here, there's surgery over here, and there's lots of options in between. And my job is to help them figure out what's going on and give them an idea of what treatments are appropriate and what are the success rates of the different interventions. And there's physical therapy, chiropractic, injections, there's holistic therapies, there's a lot of different things that patients can try. And I don't like to see patients wasting their money on things that aren't going to help. And if surgery is really their best option, I'll tell them this. But certainly I try to look at it like it's my problem and how would I want to treat myself or my loved one, and that's kind of how I try to guide my patient.
You know, you go through all those conservative methods, but I know there are times when those don't work. So when does a person become a candidate for surgery?
Well, like I said, if they fail conservative care or they feel that, and they are a candidate for surgery and they're ready for it. And what surgery does is surgery changes your anatomy. So our job is to figure out, is there something going on with the patient's anatomy? There's a disc that's herniated, there's a cyst, there's a bone spur, there's an instability problem, and identifying what the underlying cause of the pain is, and then is there a way that we can change the patient's anatomy to solve that problem, to take a pressure off a nerve, to stabilize a level that's moving inappropriately. And that's really the role of surgery.
Yeah. I know you brought us a couple of show and tell things here. These are kind of explaining what happens when somebody needs surgery, right?
Yeah, so we have a variety of different tools to show patients. I'm a very visual learner, and a lot of patients can conceptually understand when they can see things. The words can be confusing, but pictures have 1,000 words, right? So we have three-dimensional models of the spine, including the pelvis, the hip joints. It shows the vertebral bodies and the bone structures. It shows the discs. This is representative of a herniation. And then the yellow structures are the nerves that are coming out of the spine. So we can three-dimensionally show them what we're seeing on the MRI scan. And then conceptually, I use things like acrylic models when we're talking about putting instrumentation into the spine. So implants that are designed to affect a change on the spine and maintain that change while the body's healing. So this is a model that I use to show if a patient has a collapsed disc herniation, I show them where their nerve might be pinched on the spine model, and then I say, okay, if your disc space is collapsed, your nerve is being pinched right here. So the goal of surgery is to unpinch that nerve. Well, why is the nerve pinched? It's pinched because you've lost height on your disc. And by putting a spacer into the spine, we can affect the change on the spine, which unpinches the nerve. And if the bone is stabilized in this fashion with a fusion, this is a fusion device, if it stabilizes in this position, that nerve can never be repinched again at that location. So patients can see that. They see, hey, this is what's happening. I explain this to my chiropractor colleagues as this is indwelling traction. So people can apply traction to this area to make their nerve feel better, but when they stand up and walk again, gravity takes its course and the nerve can get repinched. So this is the way that we can permanently put traction in the spine to solve that problem.
And I would imagine a great relief of getting rid of some of that pain as well.
Yeah, some of our most successful operations are when patients have pinched nerve structures, spinal cord and nerve roots, because that's tremendously painful. If anybody's ever had a pinched nerve, it can cause a lot of pain that radiates down the arm or the leg, and that really should be reversed after the surgery pretty immediately. So it's pretty rewarding to be able to help people with those types of problems and have them come back
I'm
and
sure
saying,
it's a great relief, great relief. Now, if somebody's experiencing some serious back pain right now, best suggestion to start off, go see your primary care physician?
There's a lot of different entry points. Primary care, chiropractors, and we have physiatry doctors that do a lot of entry-level stuff. I have patients that are referred to me word of mouth. I've helped somebody that they know, and they say, if you have a problem, you should go see Dr. DeWitt. So I may see them having had no conservative care or treatment whatsoever, see them, evaluate them, they go through the same process, and then we decide, what's the most appropriate next step for them. And most times it's trying chiropractic, trying physical therapy, as long as there's no red flags. There are certain things you want to rule out that can be bad sources of back pain, like tumors, fractures, infections. You want to rule out those types of things. But most back pain will improve with conservative care and not need an operation.
All right. Well, we appreciate you taking some time with us today.
Absolutely. My pleasure.
Thanks. If you have any questions or you'd like to set up an appointment with Dr. DeWitt, you can give us a call here at Aurora Medical Center in Oshkosh at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.